Want to know what knee pain, ankle stiffness, Achilles tendonitis, and plantar fasciitis all have in common? That would be tightness in your calves. Tight calf fascia, to be specific, either dense, shortened tissues or fascial adhesions, knots, dense balls of tissue in your calves. Those can cause all kinds of pain below the knee. And I'm going to show you how to release your calf fascia in this video using a yoga block. Now, why would you want to use a yoga block? Why not use a foam roller or one of the other tools I've shown you how to use for your calves on this channel, like a softball or the rolling pin? Well, I've been going to hot yoga lately and loving it, and I usually get there 20 minutes early because I like to get my spot, the spot I want. And then I have 20 minutes to go before class starts. So I've been grabbing a yoga block and playing around, and it turns out this thing right here is really good for releasing the adhesions on the outside of your calf. So I wouldn't necessarily say that this is the overall best way to release your calf fascia, but it is probably the best way I've found to release those adhesions on the outside of your calf. And those adhesions in particular are going to cause lateral knee pain. It could pull on or irritate the outside of your ankle, causing that ankle stiffness, or perhaps heel pain, plantar fasciitis on the outside of your heel. And then some of the adhesions in the belly of the calf can cause plantar fasciitis or pain on the bottom of your foot, in addition to Achilles tendonitis. So you may want to use this technique if any of those apply to you. Or if you don't have a yoga block, you can explore my other techniques where I am showing you how to do it either with a foam roller or something like a softball. And then I do have something called the One Stretch here on the channel. It's an amazing calf stretch primarily. You're not necessarily going to get those fascial adhesions, but if you have anything like chronic inflammation in your body where your ankles are kind of swelling and you maybe suspect systemic inflammation, or you have plantar fasciitis, Achilles tendonitis, any of the things I just mentioned, that technique is amazing. So I'm going to link to all of those in the description box below in case you want to check them out. But if you are a yogi like me and you happen to either go to a yoga class, a yoga studio, or you can grab a block and play before class like I've been doing, or maybe you have one at home, then you can follow along with me today and I'll show you how to tackle those fascial adhesions. So this is actually pretty straightforward here. I'm going to use the further edge of the yoga block, and I want the yoga block, kind of, I guess, the medium height. I don't want it like this, and I don't necessarily want it like that, although that's not bad, it's just narrow. So I'm going like this and just going to drape my leg over, and I like to start low to the ankle and work my way up. That way we're opening up those blood channels from the lowest dam where the fascia is tight, if we're thinking about it in blood flow terms. And basically you are just going to either keep a relaxed foot and rotate side to side, finding any of those crunchy bits perhaps in the lower calf or Achilles region. Or you could try pointing your foot if you want a little more intensity and then rotating. You can play around with what your toes do. You could try pointing and flexing and making some circles if you like. So I just like to always give you options here. But if you're really just going after those adhesions, which is what I'm doing usually when I'm using a yoga block for this, I'm just clunking it side to side. And I'm trying to find the most effective way. So when I say clunk, I'm talking about just shearing the fascial density, the knot in my calf. And it's usually on that outer part. And I'm going back and forth over it, maybe 20 seconds per spot. Then I'm just shifting my leg, moving the yoga block here up, my leg down, and again, just, ooh, that was a good one. Back and forth, like that's a crunchy one. So, if you're like me and you run at all, I've been running on the beach lately, that'll tighten up your calves. If you do yoga, if you have glutes not firing, that can make them really tight. So you'll see me just kind of scooting up, getting closer to my knee. That's going to form these fascial adhesions. And I always get questions like, will they ever go away? Because a lot of you see me, showing fascia release here on the channel all the time, and my adhesions seem to never really be going away. And in some people, they do go away. But if you're using your body in any kind of way where you're winding up that tissue, you're going to form fascial adhesions or densities, and then you just have to take care of it like you do anything else on a daily or weekly basis. Brushing your teeth, eating well, drinking water, fascia release is the same. So I want to talk about where in the calf to pay special attention to for the different things I mentioned. So for lateral knee pain, you're going to want to pay extra attention to these high adhesions or knots in your calf. So I also want to make sure I'm really trying to shear it. So I'm moving really slow and I'm trying to break up those knots between the bone in my leg, the bones there, and the yoga block. And you can get really close to the knee or the back of the knee. So I'm just going to show you, but I think you kind of get the gist. That's a really good clunk right there, how high you can go. So it may feel more and more tender, more and more intense up here if you have these big adhesions like me. Maybe it doesn't. Maybe it just feels crunchy. But you can get pretty high, and then you'll reach a point where you're not doing a whole lot. You're just kind of hitting the tendon up there. But I would, as long as it's still crunching, I'm going to get that. So that's where I would focus my attention for lateral knee pain. For the ankle stiffness, I want this whole line, released, because it's really the dense, short, tightened, knotted up tissues just pull on that outside ankle. And I'd also do that for the heel pain that might be on the outside of your foot. For Achilles tendonitis and plantar fasciitis that's on the bottom of your foot, you want to pay extra attention to any adhesions right in the kind of belly of your calf in the middle. So it's going to be kind of on the outside towards the middle. And there's going to be a sweet spot that you find that's like, oh, that hurts. And then I also want to just mention real quick that if you have a totally straight leg, it's going to feel a little different than bent. So I have my leg bent to kind of load the fascia into my calf. And I also have my toe pointed a little bit, which is going to do that. If I had it all the way straight, you could use this outside edge, but it's not going to be very effective. And I'm all about being effective. So I like my leg bent. So you just want to play around with that. Your body might be different than mine, but that's basically it. So you'll just want to play around with this and get to know your calf and how does your calf work on a yoga block. It might not. We're all different. So different shapes and tools, the shape of the tool you're using is going to meet the shape of you differently than me because we're built differently. I have these big gymnast's calves and this yoga block works really well. But maybe you're going to do better with something like a foam roller or the rolling pin technique that we have. So again, I'll link to all of those different calf techniques in the description below this video. And if you tried this for any of the things that I mentioned, lateral knee pain, Achilles tendonitis, plantar fasciitis, please share your results in the comments below this video because your success stories inspire someone else to actually not just watch the video, but actually do the technique and hopefully get a really great result for themselves as well. So thank you so much for watching this video. I hope you got a lot out of it. If you're a yogi like me, even if you don't buy a block, if you just use it when you go to the studio, hopefully this makes your practice feel a little bit better as well. Let me know how you like this, and I'll see you next time. It's in it through the body.